Do we have a mic? Do we have a mic? What do you think? Your pressure's fine, right?
My pressure's fine. I don't let stuff get to me.
Oh, okay, good.
I try not to let stuff get to me. I let
Yeah,
it
I
roll
had
on
to have a
off of me.
conversation, and I also wanted to show you guys how to use your instruments right. So I was like, everybody can have a high blood pressure, especially people who had been perfectly fine before. What is going on? So the first thing I want you to do when you're concerned about your blood pressure, or maybe a practitioner makes you concerned about you're there, you thinking you're fine. I'm fine, chilling. I'm just going to see my doctor, go to my labs. They do your blood pressure. All of a sudden, your pressure's high. And you're like, what do you mean my pressure's high? I'm fine. I feel fine. What are you talking about? That's usually the response. I'm okay. You're not wrong. The first thing you want to do is ask yourself a couple questions. One, if I am hypertensive, have been told I have high blood pressure, and I've been given medication for the blood pressure, have I taken it? Okay, and I'm not talking about you sitting outside the doctor's office and you think, oh my gosh, I got to go inside. Let me take this pill. It does not work like that. And you don't know how many times people said, I go, did you take your pill? Oh, yeah, I just took it. Well, that's not going to help us. Okay, you need a good hour for it to kick in. So if you know you're going to any doctor's office, not just your PCP, and you're supposed to be taking blood pressure medicine, take it preferably the day before you take the one the day before. Plus, I have to say that because it'll be like, oh, I'm going to the doctor today. Let me take my pill. It doesn't work like that. It has to accumulate. You have to build it up in your body. If you're going to the doctor, though, take it early. You got a 10 o'clock appointment. You wake up at 5. Take your medication. Blood pressure medication does not have to be taken with food. Okay? I know a lot of people think, you're right, they think you need food. You do not, unless your doctor says specifically, take this medication with food. Okay? But I'm telling you, 90% of blood pressure medications don't need you to eat. Okay? So even if they say to you, fasting, unless you're going to surgery and the doctor says, don't take anything before surgery, ask this question: what about my blood pressure medication? Because you'll be there on the operating table, they take your pressure, it'll be 200, and they go, we're going to cancel this surgery. Okay, so make sure you ask that question. Does that include my blood pressure medicine also? Okay, let's go back. So you go to the doctor, take your medicine. Did I take my blood pressure medicine this morning, early? Did I take it yesterday? Second, bring a log of your pressure readings. That would mean you've been checking it. Okay? Even if it's on your phone, now they have apps that you can record your blood pressure, but take it. You know why? Because you're going to have been taking your pressure at home. It's been great, 120, 130, 135, and then you walk in the doctor's office, white coat syndrome kicks in, and it's 170. And then you'll be trying, no, doc, you see, no, it's always good. It's only you. I have that, what that thing is? Oh, yeah, that white coat thing. That's what I got. And the doctor will look at you like, sure, here's a pill.
But doesn't that really affect you when you
Of course.
tend to go up in there?
Yes. Anxiety, worry, nervousness. That's why I started speaking and say, I don't know what's going on. Maybe it is a war. Maybe people concerned watching too much news, listening to much negativity, having fights with people before you go to the doctors. I had one person who got in a fight before they came to my office. Not a physical fight, and then, I'm taking the pressure and it's an absolute mess, but that's not real. It's not real. So if you haven't taken your blood pressure medicine and you have been monitoring it though, and every day it's been 120, 120, 130, bring that information with you, because the doctor's going to say, look, it's 155. I need to give you something. And you're going to be like, another pill? But if you have the documentation to show, a good doctor will say, okay, keep checking it for me and come back in 10 days and we'll take a look to see if it's still controlled. I don't go on one reading, and nobody should ever go on one reading to make a diagnosis of hypertension, right? Anything could be happening. But what we do know is all it takes is one time for your pressure to get extremely high for you to have a stroke. Okay, stroke is death of brain cells. And when certain cells in the brain die, that can lead to problem with speaking, walking, talking, even if it's just a TIA, a temporary thing, right? We don't want that. So all it takes is once, so we do as doctors get alarmed. You walk in and you're 180. So I'll usually have people sit down, get calm, wait 15, 30 minutes and see if the pressure resolves itself, right? So you're checking, did I take my medicine? Do I always take my medicine? Am I upset, angry when I walk in? And talk to the doctor. Say, hey, look, I was upset. I just got off the phone, or I just got in a car accident. I just got bad news on the phone. Have that talk. I don't think this is real. I don't think this reading is representative of what my regular readings are. But if they look at your thing and it's up and down, it probably is, right? So I wanted you to check that. The other thing, too, now we're using these electronic equipment, right? Everybody got that. Press the button. Please keep very still. Raise your arm above your heart rate and be very still. No talking, please. Your blood pressure is good. Have a nice day. That's the one in my office. She's very pleasant. But these automatic cuffs, one, make sure you're using it correctly. So for most of them, that's why I have my model here today.
Let me take this watch off.
When you take your blood pressure, first make sure your equipment is working in an orderly fashion, which means that the batteries are good. There's a little thing on the automatics that flashes when the batteries are going dead. You will get an erroneous reading if it starts to flash and you just ignore it, right? Second thing it always says is when you're doing it, remember the ones for the wrist, they should be turned over this area where you can feel the veins and tendons, right? And we'll use this arm so people can see. Right here. But one of the things, make sure you're putting it correctly. Don't put it upside down because you'll get a bad reading. Now, the one I have today is a manual. So you have the automatic and you have a manual. The manuals, I prefer the manual because I was taught, I don't even know how to use the automatic. That's how we were taught in school. But guess what? A couple studies have come out that says the manuals are better, the automatics are better than the manuals because people make errors. But I'm a doctor for 30 years. I don't believe that. But anyway. But if you do have someone who can take your blood pressure, even when you go to the doctor's office, make sure they're doing it correctly. I've walked into rooms with the blood pressure cuff down here, the blood pressure cuff all the way up here. Make sure that they're using it correctly, putting it on you correctly. What is correct? First thing that has to be correct is the size of the cuff. If you have big arms, right? What I call the above average. Don't be using the baby cuff. You will get an erroneous reading. They call this the average cuff site. I don't know who's average in America anymore, but this is called the average. But if your upper arms are larger, you don't want to use an average cuff. They have extra large and they have large. So first thing you have to make sure, look at them. And you can tell. I know some patients tell my MA, don't use that on my, that's not going to be right. They tell them, this is not the right size for me, right? So once they do that, the next thing you want to make sure is where are you placing the cuff? Where? It's not to be placed down here. It's not to be placed on your deltoid. It's take 2 fingers right in the middle of your arm. You put 2 fingers and you start placement of the cuff above those 2 fingers. That's where it goes. It doesn't go right where you can't fold your arm. If you can't bend your arm, it's too low. It has to be placed 2 finger breadths, and I'll show you. The good thing, too, is you see this little thing right here? They even give you a diagram. At least this cuff did it. So, yeah, it's trying to make it, foolproof for us people who don't know. The next thing is, this is called a bell. This is the thing that measures. This is going to measure. This is a spirometer. Anyway, blood pressure machine thing. All right. It hooks right in here, so you can read it. Now, open it up enough that you can slip your arm in it, right? So, if you feel here, this is where these tubes are coming out. This is where you want to place it above that fold I told you about. So we're going to go 2 finger breadths above. This is 2. See? Okay, we got the tubing right where we want it. We want to hold this, get this nice and tightly placed, right? Not too tight that you're suffocating somebody, but all right. We put it upward so that we can actually read it. Now, if they want you at arm's length. So I always tell people, if you're having someone do it manually, make sure they have your arm heart level, right? And the automatic ones, they tell you to cross it and hold it here so it's arm level. Why? It gives different readings, okay? And so what I do if I'm doing manual, I'm going to pump this little fat thing here until I stop hearing a sound. That's the large number. And then I release it, and then I'll hear another sound. So one is the systolic, and one is the diastolic, right? The first number is the systolic, which is when the heart is pumping blood to the rest of the body. Diastolic, the bottom number, is when the heart is relaxed and filling up. So all day long, it's doing this, right? So when it's doing this, that's the high number. And when it's doing this, that's your low number. It should not be over 140, the high number, and it should not be over 90, the bottom number. Okay, that's when they start telling you it's high. Okay, notice I have it, I rested on my hip, the person's arm on my hip, it's at heart level, or if you have the automatic, you can put it across like this. But if you notice, key, she can fold her arm, right? Now, if I had put it down here, something's wrong. And you got to pay attention because not everybody was taught this the correct way. I'm going to use that word. I seldom like to use correct, but there's a correct way in doing a blood pressure. Now, the other really important thing that I love, feet on the floor. Don't have your feet crossed. Other thing I read about, and I had to read, I encourage everyone to read. If your bladder is full, it affects your blood pressure. Yes.
Wow, didn't know that.
I didn't know that either. Yeah. So when you get to the doctor's office, ask them if they want a urine specimen. Right. Don't go empty your bladder and then they come back, oh, we need to check your urine. And I ain't got nothing. Right. So ask them, do you need a urine? I'm going to go to the bathroom. Urinate, empty your bladder, before you come to the doctor's office, when you get there, and then feet on the floor, arm at heart level.
Let me ask you one question, doctor.
Sure.
Because I never knew about it arm lift. I usually just put it on the table.
Arm lift.
Yes. Okay.
Yeah. Pause for me, friend. I need to grab some water. I left my water jug. Oh, any energy drink, whether it's green tea, which is supposed to be good for you, and also caffeine. Yeah, it's the question, does caffeine affect blood pressure? It doesn't, thank you. It doesn't affect blood pressure on everyone, but if, I always talk about as being individuals. Know yourself, right? If you find that every time you go to the doctor's office and you've had your cup of coffee for the morning, you may want to hold off on the cup of coffee and see if the pressure comes down or is at least lower, right? I know it makes my heart rate race, so I get a little bit of palpitations, So I don't take coffee just because for energy. I already have energy, but
I have low blood pressure.
Yeah.
It's always low. And my doctor tells me to drink coffee.
Yes. Oh, so for your what we call hypotensive, that means your pressure is low. Caffeinated products can help you. But the only time I get concerned about hypotension, hypo meaning low, hyper meaning high, is if you're symptomatic. Athletes have hypotension, if you were to give them a title. Their blood pressures are pretty low because their heart is physically fit. Their heart rates run under 60. And they say the average heart rate, that's how the heart beats, should be between 60 and 100. And guess what? Athletes are running 54, 45 because they're that fit. Same thing with their blood pressure. My blood pressure averaged 100 over 60, and that has nothing to do with being fit, I tell you that. But you ought to know, you have to know yourself. When is it a concern to be hypotensive? You're taking blood pressure medicine and you notice you're dizzy all the time. Check the pressure, it might be going too low. You bend down and you try to get up and the room spins or you start seeing black. That low pressure is too low for you, right? But if you have your pressure under 120, over 80, and you have no symptoms, no dizziness, no lightheadedness, no feeling weak, giddy, there's nothing wrong with it. There's not a problem. So my last toy that I want to share with you is this thing called a pulse oximeter. Okay? And they're pretty inexpensive enough. And if you have an Advantage plan, you can use your monthly card to get one. This is a pretty good thing to have, especially if your heart rate tends to every now and then skip beats or start racing. If you've ever been told you have a condition called atrial fibrillation, okay, where your heart's just racing 120, 130, we don't want to do that because if the heart races, it's like an engine that races. If a car engine races too high, you can affect what? The timing belt, right? Your timing belt in your heart, you have a belt, a device inside that allows you to actually, thank you, to keep your heart running at a specific rate. So this cool instrument called a pulse oximeter, I got mine on Amazon, there's one in Walmart. It gives you two readings. The top one will tell you how much oxygen is in your blood. And that's important. Oxygen is your fuel. People always say, no, blood is my fuel. Not really. Blood is the bus that carries the oxygen. Okay? So when your blood goes down, that means you don't have enough buses running around in the bloodstream that's carrying the oxygen, right? You need oxygen to live. When an organ dies, like with a stroke or a heart attack is a death of part of the heart. It's because blood could not get to that organ. Blood could not get to the heart. Well, what does that matter? If blood's not getting to the heart, then its passenger, which is oxygen, doesn't get to the heart. Any organ, any human that doesn't get oxygen will die. That's why when you're out of space, they wear the spacesuit. That's why when you go deep sea diving, you wear a dive suit to provide oxygen to your blood cells, and every tissue in your body needs oxygen, right? That's why smoking is such an issue. People don't realize it, but if you start, you can always, I spot a smoker. I've been at this for a while. The lips start changing colors. The reason it's changing colors is because of lack of oxygen to that area, right? You'll see it in the gum lines, you see it in the nails. It has to do with blood flow. Legs, if you have vascular disease, circulation problems, you will see changes in the colors in your legs. So think of oxygen and blood cells being the bus, and when you lose your blood, become anemic. That's why people get tired and weak, oxygen deficiency, right? So this is this cute little device. When you turn it on, it monitors the top number, monitors your oxygen. It should be over 95, right? If it gets under 88, they're going to tell you to get some oxygen to walk around with. And then the bottom number will tell you what your pulse is, how fast your heart is racing. Think of the pulse as the flow of blood. You want the flow to be steady and you want the flow to be at a good rate. You don't want people racing down the tracks of your bloodstream because eventually you will throw the train off the track if you go too fast, derail. So that's why we don't want the heart pumping over 100, right? We end up derailing, that leads to a stroke, right? So this little device, you press the button right in the center. It should be placed on your finger. Now notice it has an indentation here. So you want, and there's a little light. I don't know if you can see it. There's a light. You want your finger to be over the light. And then you wait. And if your battery's not dead, you'll get a number. And her oxygenation, that's the oxygen, is at 100%, and she's really calm. Her pulse is at 81, which is excellent. Now, cool thing, if you have an iPhone, embedded in the phone is actually a device that will check your oxygen level. Play with your phone. Yes, play with your phone. I think it's under health monitoring or something in there. And you put your and you put your finger on the light area, and it'll actually will tell you what your oxygen level is and what your pulse is. Is that cool? Anyway, not an ad for the iPhone, but I only have an iPhone, so I know that. All right.
I have one question right here.
Yes, ma'am.
When you use that automatic blood pressure thing, the little heart that's on the bottom when it tells you the high and the low, what is that measuring?
Okay.
It's your pulse or it's your heart?
So most blood pressure is actually, well, there's 3 readings that you get on a blood pressure device if you get one of the automatic ones. They give you the systolic. So you have the high number, the low number, and then you have a heart rate. So that's your pulse, that's the diastolic, and that's the systolic. Okay? And so you want these numbers to be present and pay attention to each one. Pulse is the amount, the flow. We don't want that over 100. And the diastolic, we don't want that over 100 either. And we definitely don't want the top number to be over 140. Okay? All right. So any questions? What's it called? Health. Oh, okay. It says health. Health on the iPhones. Somebody will have to tell me what the Android has. Oh, you have to pay for it? Oh, man. They get you every time. All right. Thank you. Okay. Thank you so much.
You're welcome.
All right. So today I want to go over the nitty-gritty and to make it plain for you about health insurance. And as I said, Fran's here to assist you. This is open enrollment. It's open enrollment. What does that mean? We use that word. We throw it around. Time to pick a provider, but it's also time to assess whether or not you're satisfied with your health plan.
I want to help you out because sometimes as we getting younger, we kind of forget which one is the high, which one is the low, and stuff like this. Okay, this is what I have for you. The systolic and diastolic. The one that starts with the D, diastolic, and you just think it's down. And the systolic, the sky. So like this, you can remember.
Yes.
Which one is higher and which one is lower. And also for the
Pulse.
The pulse, almost the same thing. You got the figures 120 over 80.
Okay, I like that. S for sky, D for down with that. Okay, we want it down. So let's talk about the basics of Medicare. First thing you want to know is open enrollment. Open enrollment. All right, now they're talking. It's open enrollment time. What does that mean? Well, every year, October 15th until December 7th, is what they call open enrollment. And it's not only for Medicare patients, it's also for many health commercial plans. Many businesses have open enrollment. And that usually goes from October 15th until December 7th. And it means time for reevaluation. Isn't it nice? The federal government gives you time to really think about your health plans. Imagine if they did a annual physical day. This is time for your annual physical, and they did as much work at advertising for everybody to go get their physicals as they do with enrollment. And just a thought. So open enrollment is important to you because it means it's time to assess. It's time to evaluate what insurance I have. You're asking yourself 3 questions. 1, do I have insurance? If you're 65 and older, you qualify for Medicare, right? 65. Or if you're disabled. So you could be 55 years old and you can get Medicare because you may be disabled. And during this period of time, you can assess what plan you're currently enrolled. So, do I have a health plan? And the second thing is, do I like my health plan? Now, mind you, you're not marrying these things, right? You're only dating. You're only dating. So it's a time to decide, do I keep dating? Or do I need to look for a new boo? Okay? So then you have to say to yourself, like I always tell you with dating when we do sex one-on-one, you got to come with a criteria. You have to know yourself. Just like you know yourself when you're in a relationship and you look to partners and you say, does he like jokes? Does he like funny movies? Can she cook? Can he cook? You know, you have to have an assessment. The same thing happens with your health plan. What do I need in this relationship? For my health plan, what do I need? Does anybody know what you need in your plan? Because it's going to be different. What do you need in your plan?
Well, my plan, I like to, the doctor is very important to me. If I like that doctor,
Okay.
I'm not going to skip over there because then you can get $175 a month. So the doctor that I go to is very important.
Okay, so for this person, the doctor's important. They can be giving you $250 a month, but no, I have to like my doctor. Okay? Not even, look, there are a lot of people, that's not number one. So know your number one. What's important to you?
Same thing.
Okay.
Primary.
Benefits.
Okay, benefits. For some people, it's benefits. Which benefits do you find important?
Aye.
No, hers. Which one's important?
I don't know.
Okay, what, so this, yes?
Zero balance.
Oh, wait, that's money.
That's what I like about my program and my plan.
He likes zero. He likes money.
I can go to a specialist without the doctor's approval.
Okay, she likes freedom. Freedom. We got freedom over here. What do you like?
My primary and dental.
Okay, primary and dental. I got to put these on the board. Do you know what you like?
Dental.
Okay, we got dentals. Yes.
It's easy access to your medicine.
Easy access to your medicine. So medications. Can I get my meds? Anybody else? What do you like?
Zero payment on my medication.
Okay, we got the money over here. So we've got a lot of things that are important to people. What do you?
What I mean by benefits is what I do. I look up every doctor and whatever they have, whatever they offer. Then I look it up and see if I have any of those symptoms.
Okay.
And if the plan covers those symptoms, then that's the one I go with.
Okay, all right. So very important. So she's matching her needs with the doctors and their plans. So I'm going to give you, let's write these up because I think this is really important.
But I was, she was talking about doctors matching up with her plans. Most primary doctors, if it's something out of their specialty, they send you to a specific doctor, like a specialist, like an orthopedic
Yes.
doctor or something like that.
Yeah.
But sometimes, okay, what the doctors don't do, you have to do a special assessment of your own body. and do the blood work for, I don't remember what it's called right now, but do the blood work for you. And according to what's going on in your blood, that's who you go to for that specialist.
Yes. And that's the PCP's work, to do the blood work and then I think you're saying the same thing. But let's write up these criteria. So we had people who said, 1, I like my doctor or doctors, right? 2, we heard 0 cost. We also heard medications. Someone said the medications have to have access. Another person wanted freedom. Freedom to choose their specialists. Okay? Oh, someone said hospital. Oh, dental was huge. Dental was really important. And vision. And hospital. All right, so we're not going to talk about commercial today. Commercial plan. Commercial plans are those plans offered by the job that you work with. Like you might have worked with Dade County Public School, and when you worked with Dade County, the health plan that they offered was Cigna, right? But when you turned 65, you were able to get a Medicare plan. Now I have to explain that there are 2 types of plans. You have, and I can't write it in orange, I have to write in pink. You can stay with Medicare. That's the red, white, and blue card. Okay, and I've said this before. And you get that as 65 or older. So I'm going to put red, white, and blue. But you need to know this plan is an 80-20 plan. Okay, let me explain. 80-20. Meaning the federal government pays 80% of your bill and you are responsible for 20%. So if the doctor's visit costs $100, Medicare will pay $80 and you must pay $20. Okay? Oh, that's we call it a co-insurance. That's what. It's really like a supplemental. Yes. Supplement's another thing. So you see this 20% here? That's yours. This one is the Gov. Okay? Now, also under Medicare is what we're talking about, Advantage. Now, understand, you cannot have Advantage and red, white, and blue straight Medicare. You can't have both. Once you choose an Advantage plan, you no longer walk around and say, when someone says, what's your insurance, and hand them your red, white, and blue. You need to hand them whatever Advantage plan that you took out. Humana, Aetna, Solis, Coventry, United, AvMed, whatever the plan is. That's the one you give for all your healthcare services. Okay? Do not pull out the red, white, and blue card unless you're enrolling. When you're enrolling, they're going to want to see the red, white, and blue card just to confirm that you qualify for an Advantage plan. Now, here's the tricky part. You see all these things that are criteria for you? You have to think about yourself. Which is number 1 to me? What's number 1? And what was number 1 last year may not be number 1 this year. Last year you wanted all your teeth fixed. And this year you want to work on your hearing. Okay? Or you may want to get your eye surgery because you've had glaucoma for a long time and cataracts and you need the surgery and you've been putting it off. But this year I'm going to take care of it. So you might have a plan that has great coverage, lots of doctors to choose from when it comes to, getting your teeth fixed. But that same plan may not be the best plan for your eyes. So you have to decide what is number one for you. And just because your sister, cousin, brother, auntie, and best friend thinks that the doctor's important, it may not be what's important for you this year. You might have been in a car accident and you still don't feel as good as you want to, and you want to do physical therapy because you did really well going to physical therapy. And the plan that you won before only gave 20 visits. You used up all 20 visits for the year, and you couldn't get any more therapy unless you paid for it. But you might find this year you have a plan that's out there. I don't know which one it is. I'm not advocating any particular plan. Fran has a list of all the plans that I accept. But you got to look for the one that has the physical therapy. They'll give you maybe unlimited therapy. So you can go once a week for the whole year. Right? Or they might even come to your house. So you want to investigate what is important to you. Now I want to address the topic of freedom. In the Advantage plans, there are two. You have HMO and PPO. I call it the pay-to-play plan. Now, they're all Advantage, meaning 65 and older.
And what's in between the two of them that I found out that was very beneficial to me this year? There's a POS
Point of service.
Yeah, in between the two of them. And fortunate for me, I like the Memorial System, and they took my Advantage plan as an HMO. So, but if I went outside of it, then it would act like a PPO for me.
Yes.
But yeah.
So she has a hybrid.
POS.
The hybrid in here, but we're gonna work around this for now.
Okay.
HMO requires you to utilize a network. And I think I've talked about this before, but I'm going to beat the hammer in the coffin. Do not pick an HMO plan and then go argue with your doctor. I want to go to that doctor. My sister went to Cleveland Clinic and she has a really good cardiologist up there, and I want to see that doctor. Okay, look. HMO means you work with the network. And I'm putting Chen on blast. All y'all in Chen plan. Chen has a specific network. And you need to stop arguing with Chen people because that's the network they use. If you want to go somewhere else, you have to pick a different plan. Network, HMO. Now, with the PPO plans, they do use a network, but you have the options to go out of network, but there's a cost. Okay? There's a cost attached to it. You pay more for freedom. There's a price for being able to freely go. Now, if you're that type of person, I want nobody to tell me what to do. I want to do what I want to do, when I want to do, and how I want to do. You may want to stay with straight Medicare. Because even in the PPO plan, there is a network. HMO has a network, and if you stay in the network, your cost is zero. For some people, zero was important. Even the PPO, your cost is zero in Advantage, but you may pay more by going out of network. And the other wonderful thing about PPO plans is when you have a HMO, you must get, who's that word? Authorization. It's a very famous word. Please understand the difference between a referral
Yes.
and an authorization. It is the bane of my universe.
Yes.
I went to the doctor, you gave me a referral, and I went there and they told me they need an author. Well, they need something else, and you sent me there, and now I gotta wait. I'm sitting here waiting. Send over whatever they need, doc. I said, wait. You have an HMO. All HMOs require an authorization for service. Authorizations come from the insurance plan. That says we will pay. As a doctor, I can send you anywhere. But you don't care where I'm sending you. You need to care who's going to pay. Who's going to pay for the ENT? Who's going to pay for the GI? Who's going to pay for the pain specialist? Who's going to pay for the physical therapist? That's what's important. So if you don't want to pay, do not go anywhere until you confirm that where you're going has the authorization. Your feelings will get hurt and you get pissed if you're sitting in the office and you gave them the referral and now they tell you you need an authorization. But I want you to be aware that many people use these words back and forth, interchangeably. You need a referral. And then you say, I gave you the referral. They say, no, this is not a referral. We need a referral. That's an ignorant person. Nothing bad. Ignorant just means they don't know. So they're using the same word, but they mean different things. Referral is what a provider gives that says, like you said, your blood work comes back and you need to see, a hematologist, a blood specialist. So as a doctor, they will give you a referral to go see a blood specialist. You come in, your toes all swollen, you stubbed it, and they'll say, hey, you need to get an x-ray. So they give you a referral to get an x-ray. But don't do anything. Don't go anywhere. Don't schedule any appointments until you confirm that where they sent you, they've got the authorization, which is permission from the insurance company stating they will pay. Okay? Frank, come on up. Here's a question.
Dr. Powell, how do I make sure that they have the authorization so that my feelings not hurt?
Yeah.
Okay. So the question is, well, all right. So you're saying don't go nowhere, don't make any appointments until I know that the authorization's in place, right? Well, how do I know that? We got a call. And I know it's frustrating to you and it's frustrating to me that you're calling places nowadays. This is 2023. And the phone rings and rings and rings. And you leave messages and they put you on hold. And then somebody says they're going to call you back and they don't call you back. I can't do nothing about it. I'm so sorry, but this is 2023. You are the advocate for your health.
That's right.
You're the advocate for your health, nobody else. So if you call the doctor's office and they don't pick up, maybe it's lunchtime, pick after lunch. On Google, this is the only time I'm going to tell you about Google. On Dr. Google, for many places, they have a busy time. Some places will post when is their busiest time. Don't call during the busy time. 9 o'clock you think is busy? You think 9 o'clock might be busy? It should, but 9 o'clock, if they open at 9, it's going to be busy. Okay?
You talking about AM?
Yeah. In my office, between the hours of 10 and 1, crazy busy. And I know this because my call center have been doing statistics. So if you really want to get 4:45, 4:45, seriously. And 3:45. They told me 3:45 gets a little slow too.
That's pretty good.
I'm just telling you because that's reality.
Because I have gone
Yeah.
through it.
You be calling, trying to make the appointment, and the phone's ringing, ringing, ringing. So then you call the PCP. I've been calling and nobody answers. I need another person. And so we get you another person and the same thing happens. So you're just going to have to be patient. But I want you to understand, authorization means the insurance will pay for whatever the service is. Do not go until you're confirmed. All right? Because you're going to be sitting there waiting. Yes, ma'am.
So when you get a referral from your doctor,
Yes.
the doctor don't know that you need authorization. And the doctor giving you the referral, and then you say you go to the appointment and say, oh, you need authorization, and you get confused. The authorization being you think the referral is also the authorization. Because a lot of people get confused.
Right, and that's why I'm having this conversation. If you belong to an HMO, you need an authorization. No, patients do not do authorizations. Your insurance company, your PCP must get the authorization for whatever service you need. Right? They can give you the referral, but don't do anything until you get the authorization.
I got a referral from my doctor to go to do a test, and they accept the referral.
Okay. Now, they accepted your referral because they already had the authorization.
The doctor already called it in.
They already had it. And there's a place in the clouds called Ability. If you log into Ability, for most HMO plans, the authorization is there for them to see. Okay? So you may get it, and wherever you go, all they do is log on, and if it's completed, they will accept you. But just take my word for it. Don't show up at any specialist or diagnostic center if you have an HMO until you confirm that they have the authorization. Don't want your feelings hurt. Yes. Now, back to Medicare. Why is this important for you during open enrollment? If you can't be bothered with all that, I cannot be bothered. I stumped my toe. I got a good friend whose daughter is a podiatrist, and she said she'll see me tomorrow. Okay? I'm putting on my clothes, and I'm going to her office tomorrow. If you're that person, get a PPO. Okay? Get yourself a PPO. Save the pain. Or select one of the few plans like Preferred. Preferred does not require an authorization. Okay? Preferred doesn't. And there may be a couple of, Fran, some other ones that doesn't require auth?
A lot of them have automatic. A lot of the plans are making a lot of changes right now. The plans, they're changing their technology. So a lot of plans have automatic approval for your authorization when the referral is sent over.
Okay.
So remember, the authorization is like permission.
Yes.
Don't go without permission.
Yes.
Okay.
Right.
That's your permission. It's sort of like when we were in kindergarten. Remember you had to go to the bathroom? And you're sitting in the chair and you'd be like, to the teacher, you had to wait. And what would happen if you got up and just went to the bathroom? You'll be suspended and sent to the principal office. That's the old school. Nowadays, I'm going to the bathroom. Okay. I see you deuces. Okay. But in the old school, we had to sit there. I gotta go. Can I go, please? And don't let somebody else be gone to the bathroom. You had to wait till they get back from the bathroom because they wouldn't let two of you be in the bathroom at the same time. Right? Remember that? Anyway, that's sort of like what authorization is. Okay? I have one question. Yes, ma'am. Right here. AVILITY. That's just, it's AVILITY. That's one of the cloud places that performs authorizations. That's just one, but I know Humana uses it. I know Aetna uses it. Blue Cross uses it. And a couple others use it. But that's not for you to access. Your PCP, the specialists, the diagnostic centers, they have to look in that system to check if the authorization or the permission was given. So as you choose what plan you want to be a part of, know thyself and be true. If you're an impatient person, if you don't like to wait on anybody, you may want to spend the extra money and get a PPO. But if you've got patience, understand the process and wait. That is not to say if an emergency does not arise. And I know in my office, if there's an emergency, somebody walks in and they were in a car accident and they injured their back and they need to go see, get an x-ray immediately, I have my referral coordinator stop everything and take care of it. But everything is not an emergency. Because if everything's an emergency, then nothing is an emergency. Right? So just because it's happening to you does not make it an emergency. My criteria, blood, guts, and dying. Is there blood involved? Are the guts seeping out or exposed? And if this does not get done immediately, it runs the risk of you dying or end up in the hospital. So if it's not fitting that criteria, wait the couple of days or hours that needs to be waited, right? Because other people do have emergencies. Okay. So your criteria, what do I like? What do I need? Do I keep dating the same plan or do I change to a new plan partner? Right? Find out which is number one. And there can only be one number one. There can't be two. Well, I need zero copay plus I need to have medications. No, you got to pick one. And then let the others be secondary. Okay? All right, guys, I'm going to do another one next week and I'll tell you, okay, now that you've picked your plan, where do we go from here? What comes next? And that'll be our next class. See you then. Oh, questions. Let me have your questions. I'm going to answer these. So check me out on Dr. Powell at Dr. MC Powell, and I'll be answering all your questions online. So please check out Instagram and Facebook for your answers to your questions. Thank you.